In this video, I will provide you with the necessary information about the drug Lipitor. Make sure to subscribe to our channel for more health-related insights and helpful tips for a healthier lifestyle. What is Lipitor? Lipitor is a cholesterol-lowering medication belonging to a class of drugs called statins, containing a compound called Atorvastatin calcium. It helps reduce high cholesterol levels and may lower the risk of heart disease. Lipitor is used in the treatment of high cholesterol and cardiovascular diseases. It is commonly used to lower LDL cholesterol, often referred to as bad cholesterol. Mechanism of action of Lipitor. Lipitor works by inhibiting the production of cholesterol in the body. It targets an enzyme found in the liver, reducing the synthesis of cholesterol, thereby lowering cholesterol levels in the bloodstream. How to use Lipitor? Take this medication by mouth with or without food as directed by your doctor, usually once daily. The dosage is based on your medical condition, response to treatment, age, and other medications you may be taking. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says you may do so safely. If you also take certain other drugs to lower your cholesterol, take Atorvastatin at least 1 hour before or at least 4 hours after taking these medications. These products can react with Atorvastatin, preventing its full absorption. Take this medication regularly in order to get the most benefit from it. Remember to take it at the same time each day. Precautions while using Lipitor, warnings and contraindications. Before taking Atorvastatin, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. Limit alcoholic beverages. Daily use of alcohol may increase your risk for liver problems, especially when combined with Atorvastatin. Regular health checkups should be conducted while using Lipitor, and attention should be paid to diet and exercise. Additionally, it should be used according to the instructions given by the doctor. The use of Lipitor is not recommended during pregnancy and breastfeeding. Additionally, individuals with liver problems should consult their doctors before using Lipitor. Side effects and precautions. Lipitor use may result in some side effects including muscle aches, digestive issues, headache, liver problems, and, rarely, rhabdomyolysis. Alcohol consumption may worsen these side effects. If this video was useful for you, please like the video and subscribe to the channel. And express your opinions and experiences in the comments section. I wish you healthy days.